Hi, I'm Dr. Amy Myers, the founder and medical director of Austin Ultra Health, and this is our video on hormones and hormone lab testing. So this is probably the fourth most common test that I order, and obviously it depends on what you're coming to see me for, but even if you're coming for hormonal imbalances, menopause, hot flashes, irregular periods, we're still starting with the foundation that we've kind of worked our way up to here. So still starting with the Myers Way, and then also starting with the stool test. I find, again, by going through both of those processes and testing and fixing the gut, a lot of imbalances heal themselves and get put back into balance. So people who are having irregular periods, painful periods, fibroids or endometriosis, of course I'm talking mostly about women here, but men with low testosterone, a lot of those things get back into balance when we start fixing the diet and fixing the gut. So typically, if you're in that category of someone coming in with irregular periods or painful periods or heavy periods or low testosterone, we're going in a stepwise fashion and still going to check the gut, go through the dietary changes with the Myers Way, and see what what reveals itself and what gets back into balance over the next month to potentially 3. Again, really depending on you. So I don't just throw out hormones. I see all kinds of people who are have their hormones out of balance, women who've been told in their 40s that they're going into menopause or that they're perimenopausal, and or even in menopause already and they've stopped having periods, that come out of menopause because we get things back into balance. So our goal is to heal things naturally and not to just throw some hormones at you. Even if they're bioidentical hormones, which is what I do, of course they're more natural, they're safer, and it's what our body knows how to utilize. But even in that, we're going to go through the stepwise fashion of fixing the gut and healing the gut and changing the diet and seeing what resolves there. After all that has happened, or of course if you're someone who has artificially gone into menopause, i.e. you've had a hysterectomy, then we may get to that step or get there sooner, because as much as we try to get your body back in balance, if you're missing the organs that make the hormones, there's a limit to what I can do. So when we are talking about hormones, I'm not going to go too much into detail about all the hormonal pathways and whatnot. The main thing that I want to bring up here in this particular video is about the testing that we do. So when we are talking particularly about females and men as well with prostate cancer, but looking at your risk factors for cancer. So many women, of course, that is their primary concern when we even bring up the issue of hormones is, well, what is my risk for cancer? I don't want to get cancer. I'm scared about going on hormones. So let me debunk one myth, which is we are taught that, particularly with women, that our risk of cancer goes up based on how long we have been exposing our body to estrogens. And I just want to tell you that is only partly true. It's actually how long we have been exposing our body to bad metabolites of estrogens. So we have estrogen and then our body goes to get rid of that estrogen. And how do we do that? We break our estrogens down into good protective metabolites of estrogen and then bad cancer-causing metabolites. So what I want to reinforce to you is that you could have either very high levels of estrogen and never had children, and what you're breaking your estrogens down into could all be the good cancer protective metabolites. Or you could be what I typically see in my office, women who are postmenopausal, having symptoms, and they're skinny and they really don't have any estrogens. Estrogens, of course, are stored in our body fat, and so women who are heavier as they go through menopause tend to have an easier time because their fat cells are still secreting those estrogens. So I see a thin woman who really should be on estrogens as a protective measure against osteoporosis. She might be afraid to go on estrogens thinking, oh my gosh, I don't want to go on estrogen. There's a family history of breast cancer. Well, what I show her based on the test that I'll show you here is that she could have very little estrogens because she's had a hysterectomy and she's thin, and so she doesn't have a lot in her fat cells to be secreting on their own, that she could have very, very, very low estrogens, basically not have any at all. But what she has, she could be breaking them all down into the cancer-causing ones. So again, you can see from those two examples, it really doesn't matter what your level of estrogen is. It matters what your body is doing with those estrogens. So before I put anybody on hormones, man or woman, because again, this can equate to men in the term of prostate cancer, is have them do an estrogen metabolite test. And I'm going to show that test to you now. So let me just kind of first go over, this is all our hormonal pathway, and I love this depiction of our hormones. And so again, you can't see it too well, but up here is cholesterol. So the myth, that high cholesterol is bad. We actually need cholesterol to make our hormones. I have seen men coming in on cholesterol reducing medications like Lipitor and Crestor, and we're able to get them off of those by changing the diet and whatnot. And then suddenly when they're off these medicines, boom, their testosterone pops up. So cholesterol is what we call precursor. It's what you need to make the rest of your hormones. So again, I've seen a lot of men being on these cholesterol lowering medications. They have low testosterone. We simply get them off the medication and boom, their testosterone comes up. So we're looking here at progesterone, DHEA, testosterone, and then our estrogens. And so it's a little hard to see with this, but I just want to show you that even though I might start a woman on progesterone or a man on testosterone, and you think that's perfectly safe, or even DHEA, which you can purchase as a supplement over the counter, and you might be taking this for men for energy or body mass to improve your testosterone. Women, same thing as the anti-aging hormone. So a lot of people just take that on their own. Well, what I want to show to you is that that is not safe to do those things necessarily. It really, again, depends on how you break down your estrogen. So again, here's estrogen, and then these are what are called our estrogen metabolites. And this one's cancer protective, and these two are cancer causing. And so as you can see, you could be on DHEA, which typically comes down here and goes to testosterone, but it can come straight down here and go into estrogen. And if you're not breaking down your estrogens well, probably not what you want to be taking until we fix that situation. Again, testosterone, typically gets broken down this way, but it can come over here and go to estrogen. And then same thing with the progesterone. Typically gets broken down this pathway, but it can come all the way over and go down into estrogens. So I want to know what somebody's doing with their estrogens before I put them on any kind of hormone, because we can fix what you're doing down here, changing it from the bad estrogen metabolites to the good ones. So I require this test. It's the only test I do require, but I do require this test on anybody that I'm going to put hormones on, and certainly, recommend it to, any male with a family history of prostate cancer, any female with a family history of breast cancer or uterine cancer, or any female that just wants to know. I don't have any, family history personally of these things, but I wanted to know what I was doing with my estrogen. So I did this on myself, as I have, of course, all the functional medicine labs. I test everything on myself before I do my patients. Okay, so let's look at what that test looks like. So we can get all of your hormonal levels, but for most people, we typically just stick with the estrogens. That's the most important one as far as I'm concerned. And so again, it's checking our total estrogens and then our metabolites. Cancer protective, cancer causing, cancer causing. So let's turn the page and see where this makes a lot more sense, because I know that this is pretty overwhelming looking at all these numbers and colors and stuff like that. So I feel that a picture speaks 1,000 words, and often it's pretty easy to convince women when they see this. So this is, again, looking at our what we call a 2:16 ratio. These are the metabolites of our estrogens, and the 2 is protective and depicted in green, and the 16 is red and depicted in the red. So this little pie chart down here is theoretically how you should look. Red, bad, green, good. You may look like this, which we hope for. You may look like this. Or I have had women be literally 3/4 red, like almost the entire pie chart red. So that is not a good thing. Then, and that of course, speaks volumes when a woman can see it that way, or a man. I don't mean to keep focusing on women, but it's typically women in my office that do this test. And then the test tells us over here, this is what I really like to look at. It's called our 2 to 16 ratio. And depending on where you fall, this is high risk for cancer. Of course, lesser risk for cancer in the green. And then over here in the red, you're at lower risk for cancer, but higher risk for osteoporosis. So when we see that, I actually recommend to women that they should, go on the estrogen as a protective against osteoporosis. And then of course, if they fall over here in the bad category where they are at a higher risk for breast or uterine cancer, there are several things that we can do. And some of that information can be found on my website. I'll go over it here. So the first thing that we want to do is figure out, where are we getting these estrogens? So if it's somebody who's overweight, we're going to be losing weight, but you will have already gone through the Myers-Weight program, and that should have helped with that category. We want to be looking at if we are eating animal protein or dairy, that you are getting organic rather than the non-organic or conventional, because those animals are injected with hormones, and then they are fed soy. And then, of course, if it's eggs or milk, it's coming from that animal that was fed all of those hormones. And then beauty products. That is something that many people don't really think about, but I have an article on my blog about beauty products and the dangers of many beauty products out there. There are parabens and phthalates in beauty products that mimic estrogens in our body, and they mimic the bad estrogens. So I counsel you about getting those sources of estrogens out of your body. Or not bringing them into your body. So that's step one. Step two is always, with everything, the diet, the Myers Way, fixing the gut. There are some enzymes and bacteria in our gut that can recirculate estrogen, so we want to make sure those are all working properly. And then the third component is there is something called IC3 or DIM. When you heard the story, eat your veggies, your carnivorous vegetables, cruciferous vegetables, when you eat your cruciferous vegetables, it helps prevent cancer. And so they have isolated out the active component of broccoli and these cruciferous vegetables to something called IC3 or DIM. I personally use DIM. It's the metabolite of IC3, and I use that in my clinic, and that will actually sway someone's ratio from the 2 to 16 ratio within a couple of months. So typically if you show up that you're in the very high risk category, we do the things that I just mentioned. We put you on the supplement along with another supplement that I use called estrofactors, which is kudzu, and that helps get out estrogens as well. So between the DIM and the estrofactors, we utilize that, and then the other things that I mentioned, changing the diet and talking about the beauty products and whatnot. Within 2 months, everybody except for 3 of my patients have swayed that ratio right back to a normal level. Then we can go on the bioidentical hormones. So the 3 other patients have eventually swung. It just took them longer. It took them one person 4 months and 1 5. But typically within 2 months we make those changes, and then 2 months later we retest this test, shows that everything's fine, and we can begin our journey on with the bioidentical hormones. So, so that is all about your metabolites of estrogens, which again is far more important than what your total estrogens are. And if you're out there working with another practitioner, if they have the ability, I would definitely ask for this test. I would not recommend being on any sort of hormones or even DHEA without doing this test on yourself, whether you're a man or a woman. So again, below on the blog, if you want to post any comments, ask any questions, happy to engage. Have a pretty active Facebook page as well, Amy Myers MD. Love to see you over there. And thanks so much for your time.